The All In podcast is brought to you by the Urban League of Metropolitan St. Louis in partnership with the National Urban League, the National Action Network, Shea Moisture, and the National Coalition on Black Civic Participation.
Well, I did start off my career as a staff pharmacist at then Grace Hill Health Centers in Old North St. Louis. That location was actually at the Hadley site, the Hadley location. So That was actually 20 years ago. What we've been doing is not working, and people are not willing to say what we have been doing in the Black community with healthcare is not working. If you are Black, you are 3 to 4 times more likely to die in childbirth than a white woman. And that comes down to nothing but racism.
And welcome. This is the All In podcast. It's brought to you by the National Urban League, the Urban League of Metropolitan St. Louis, the CDC, and the National Action Network. We are all in against COVID, and we want you to be all in too. So today we have a fabulous guest in store for you, Dr. Kendra Holmes. She's a native St. Louisan, and she is the president and CEO of Affinia Healthcare. Today we're going to talk about all things healthcare in the community, prevention. We're going to talk a little bit about where we are with COVID, and then we're going to talk about some other important health and wellness issues in our community. So it's going to be a great show. Sit back, relax, tune in, bookmark the site, make sure you come back and follow us often. So welcome, Dr. Kendra Holmes.
Thank you for having me, Patricia.
You're a native St. Louisan, so you got to come on in with all of the cred. Come on, tell us all about your St. Louis experience. High school, where you grew up, that whole piece.
So I am a proud North St. Louis City resident. I went to Metro High School. So St. Louis, born and raised, St. Louis Public Schools, Metro High School. My college, university is St. Louis College of Pharmacy, now the University of Health Sciences and Pharmacy. So definitely St. Louis.
Oh, you most certainly are through and through. So I know that you've seen a lot of changes on the healthcare front, and I believe you started your career, if I understand it, as a staff pharmacist at the former Grace Hill Medical Centers, and now it's Affinia. Can you tell us about that?
Sure. So I actually am a pharmacist by trade. Didn't really envision myself being a CEO, but life happened. So I did start off my career as a staff pharmacist at then Grace Hill Health Centers in Old North St. Louis. That location was actually at the Hadley site, the Hadley location. So That was actually 20 years ago. So again, had a passion for working in underserved communities, definitely an underserved area. I've started as a pharmacist, and just gradually over the years, there's so much need in community health centers, so much need in our community. So just really worked my way up throughout the organization, was promoted to the pharmacy director, eventually took over our lab and radiology departments. And fast forward today, being the president and CEO of Affinia Healthcare.
That is an amazing journey, and I just want to pause because I want us to be present in that. I didn't see any Black pharmacists growing up. I didn't see that. So tell me about that experience, because I don't want that to pass us by.
So I didn't see Black pharmacists growing up. Pharmacy really wasn't my first career choice. I love chemistry. You can actually see behind me the periodic table. Bit of a chemistry nerd. So pharmacy really wasn't my first choice. I actually visited the campus of St. Louis College of Pharmacy and just fell in love with the campus. I fell in love with the culture and the atmosphere at the university, and that really led me to pursue a career in chemistry and in pharmacy. But like you said, I remember back in the day, Medicare Glazer was the pharmacy near my home, but I never saw a Black pharmacist. And in my graduating class, I came out with my doctorate in 2000. There were approximately 2 individuals that were Black in that graduating class. Now, we've made a little bit of progress, still a long way to go to getting those numbers up. But again, when you don't see it often you can't be it. So that's why it's really important for me to be very visible in the community so that other individuals just like me, a girl growing up in North St. Louis City, can see something and actually be that.
I applaud you for that. And I cannot agree with you more. If you can't see it, you can't be it. So having you out and about as much as you are, and you are very busy and very passionate about public health care and about community health care and about equity. So, I'm a huge fan and I do keep up with you. So, tell us about Affinia Healthcare and its role in protecting and safeguarding public health.
Sure. So, Affinia Healthcare, like you mentioned previously, Grace Hill Health Centers has been around for 117 years. So, we initially started off in that old North St. Louis area, really serving immigrant population. So, as new arrivals would come to the country, there would be healthcare services that would be provided to those individuals. So, just over the years, transformed into a community health center. Our mission is to provide high quality health care and promote healthy lifestyles for everyone. So that's underserved, that's uninsured, that's undocumented, that's unhoused, that's anyone who deserves and needs high quality health care. We're, again, a system of community health centers. We have 13 locations, so we have definitely grown over the years. And our primary focus, again, is those individuals who may not have access, may not have resources to receive high quality health care. But again, in my opinion, and the mission of Affinia Healthcare is that healthcare is a human right, that all individuals, regardless of your zip code or your socioeconomic background, everyone has the right to health and to live a healthy life. And that's what we're all about at Affinia Healthcare.
Well, I like the word you used, and I know you used that intentionally. And you said healthcare that people deserve.
Yes.
Everyone deserves quality healthcare. So we appreciate that. What are some of the program hallmarks? Some of the things that, if someone were interested in Affinia, what would they find there?
So I think what I think makes us different at Affinia Healthcare is that we've seen these health disparities. Again, I'm born and raised in St. Louis. We've seen the disinvestment in healthcare in Black communities. We've seen the regional hospital. We've seen the hemorrhage and what has happened in our communities. And these health disparities just persist. We continue to see the diabetic rates in the Black community, the hypertension, now the overdose rates. And what we've been doing is not working. And people are not willing to say what we have been doing in the Black community with healthcare is not working. Our approach really is to listen to the patient. So our whole strategic plan is based on a needs assessment. And that is asking the community, how do you want healthcare delivered? What is a priority for your health? Simply telling individuals, and that's what we've been doing for decades, telling people how they should manage their health, telling them what their healthcare priorities simply does not work. We go into the community, we're active in the community, and we ask you, hey, what are your priorities? How do you want to be healthy? How can we help you get to that point? And that's really the difference. So something that I point to for our programming is related to women's health. And we're all aware of the horrible maternal health outcomes for Black women. Black women are 3 to 4 times more likely to die during childbirth than white women. And people always say, "Oh, it's education or it's access to healthcare," and it's not. Women who have an education, women who live in affluent environments, communities, if you are Black, you are 3 to 4 times more likely to die in childbirth than a white woman. And that comes down to nothing but racism and the fact that Black women's lives and the lives of our babies are not valued in this medical system. So we focus on Black women, we focus on Black babies, and assuring that they, again, receive the quality health care that they deserve.
So, how did you how did you come to that realization? Because you're right, people will say, oh, well, it's because they have pre-existing conditions or they live in poverty in communities, maybe they don't have the right diet, nutrition. How do you overcome those what seem to be very plausible, arguments, if you will?
Well, you overcome them with data, and the numbers don't lie. The numbers don't lie. And when you look at the data across all socioeconomic barriers, outcomes, the underlying issue is racism. The underlying issue is implicit bias. And that if you look at C-section rates, Black women have higher rates of C-section. Why is that? It's not that all of their pregnancies are complicated and that warrant a C-section. It's that we are not receiving the same quality health care, and we're not being allowed to, hey, maybe our child needs to stay in a little bit longer too, to make sure that they are developed and that we don't have low birth weight babies as well. So the way I approach those, what I call them is, well, a lot of people say it's miseducation. I call it lies. I'm
Okay.
very direct in what it
Call it
is.
out.
I call it out. And it's not true. It's not true that all Black women are overweight. I work in health centers. I see all types of people. The whole country is overweight. Let's just be honest. Okay. The entire country has bad eating habits. So to say that those are the issues that are impacting the health of Black individuals is simply not true.
Well, we're going to talk more about your maternal mortality project a little bit later. I'm trying to say that fast early in the morning. And because that is extremely important. I can remember uh, a moment with my own mother. And I don't even know what prompted the conversation, but my mother and several of her friends were sitting around, and they were talking about, I believe somebody was pregnant at the time. But I remember every single one of those women had a C-section. Every single one. And I'm thinking, even at that age, and I probably was 14, 15 years old at the time, and I'm thinking, every one of y'all had C-sections? What is this about? Right?
Yeah,
So, yeah, I agree with you
that's an
100%.
excellent point. Excellent
That
point.
makes absolutely zero sense. So, you just talked a little bit about the health of this country, and we think about our community in general. How would you describe not just the health of America, but particularly the health of in our St. Louis community, in Black and Brown communities, in low income communities where there have been challenges?
So I would compare it to the health of some third world countries. If you if you look at, again, the maternal mortality rates, if you look at the overdose rates for Black men in St. Louis, is absolutely unacceptable. If we There was just a recent study that came out about dialysis and the high rates of Black individuals with chronic kidney disease and the high rates of individuals who are Black with amputations. It's abysmal. It's horrible, and it's unacceptable, and it doesn't have to be this way. Is what the issue I like to really emphasize, is that health disparities, they're persistent, but they're not inevitable. They're not inevitable at all if we take the approach that, number one, we have to acknowledge the fact that Black people don't trust the medical system,
Absolutely.
and that justification is real. There has never been a point in American history where Black people receive the same quality health care as white people, and I would argue anyone with that point. It definitely didn't happen during the Tuskegee experiment, and it absolutely did not happen during COVID. These health disparities are man-made, and they are the result of, again, discrimination, not receiving the quality health care that we deserve, and oftentimes just implicit bias. And all of that leads us to not trust the medical system. So people ask me, well, how do we change that? How do we get Black people to trust the medical system? We do that by being trustworthy. And we
Yes.
take the blame off of the people who have been disserviced, and we put it on the healthcare system. And that is where the responsibility actually lies.
So, given that, I've seen a number of campaigns come and go, marketing campaigns, community outreach campaign, call it whatever you want. I have yet to see a consistent, concerted effort that lasts over time, one voice, with people raising the alarm about the state of healthcare in communities of color. Not once have I seen that yet. What are your thoughts about it? And why aren't we?
So again, I think part of it is the foundation is the distrust in the medical system. And when you look at COVID, just when the vaccine came out, and we can also even go with testing, there were a lot of individuals in the Black community who did not want to be tested, who, again, vaccination rates are low. There's still a lot of distrust for vaccinations. And I think that some organizations are afraid, honestly, to approach the Black community and say, "Hey, this is what we need to do for our health." They're a little afraid about it damaging their brand, by saying, "Hey, you know what? We do need to get vaccinated. Vaccination works. Here is the data. I'm not going to tell anyone to do anything or give their child something that I'm not going to give to my own child." So I think that if we're talking about the Black community not necessarily having that platform, I think it's really based in the fact that they may have trust issues as well, with promoting certain medical practices. I tell people all the time, the reason that I was out there doing COVID testing on the front lines day in and day out is because I didn't trust anybody else to do it for our community. I, I didn't trust it. So I had to do it because I didn't trust that anyone was going to do it the way that it needed to be done for our community. So I said that we've got to do it.
So, one way to change and be part of that change is to actually get in it, be part of it.
You got to get in it. You've got to, again, I've been in the healthcare field for 20 plus years, and I still have trust issues with the healthcare system. So how can I not expect other individuals who don't know what I know to trust this system? And I tell people, when we were talking about vaccination, I never convinced one person to get vaccinated by saying that they were ignorant or dumb, or by judging them for
Yes,
being
guilt.
afraid. Yeah, that doesn't work. You come to people where they are, and you ask them, what are your concerns, and you try to get to the consensus. And I'm a proponent of giving people the information and allowing them to make an informed decision about their own health.
Well, I think that we can't understate the mistrust and the distrust of systems. So I know that there is a huge organic movement and natural healthcare. What are some of the things that we can be doing outside of some of the medical interventions to create a healthier lifestyle? What can we do?
You know, what I say is that the number one thing that you can do is, if you are feeling depressed, if you have mental health issues, to seek help, to talk to someone, to talk to a friend, to talk to a therapist. Non-medical, I'm not talking about specifically antidepressant medications. I'm talking about just therapy, and having a mechanism in your life where, if you have issues, and we all have issues in life, that you need to speak to someone. We in the Black community have to do better with this stigma of mental illness. We have this perception in the Black community that we are these strong, I'm a strong Black woman, I'm a strong Black man, I don't have depression, I don't have anxiety. And we have depression and we have anxiety more than any other group in this country, because it is hard to be Black.
It's hard to be Black in
It
America,
is hard to be Black, and for us to
actually
think
anywhere.
it is hard, and it makes you sick. There was just another a study that came out recently by WashU that said Black individuals who graduate from college have higher rates of depression because of all of the racism that they experience going through that educational process. So when we talk about, the non-medical, non-pharmaceutical piece, it's mental health. It is reaching out to people, and and I say that as well for our diabetics. We also refer them to behavioral health, because a lot of the sickness that we have is because we are stressed, we are depressed, we have anxiety, and you can't attend to your physical health if you are not mentally well. So I would stress number one is mental health.
So I'm going to the chemistry.
Okay.
What happens to your body when
Oh,
you have when you're stressed?
oh my goodness. So
What-
everything that Black people have,
okay.
hypertension, oh, your body starts taking on weight, all that cortisol, those hormones, you get into fight and flight mechanism where your heart rate increases, your blood pressure increases, and all of this leads to chronic disease, hypertension, diabetes, chronic kidney disease. It's stress. The stress really is what, in my opinion, is really killing us.
I a lot of people, well, I won't say a lot of people. I had a conversation where the topic was about inflammation in our
Yes.
body
Yes.
and the damage that that does. And I mean I rolled my ankle the other day and it's swollen up a little bit. I'm not talking about that kind of
Oh yeah.
inflammation.
Internal.
What exactly is that? What are they talking about? Is it internal with organs? Is
Yes.
it something in your cells? What is that when we talk about inflammation? Because we hear that a lot.
So again, it's damage. So when your body sustains continuous damage from, unfortunately, a lot of the things that we eat as well. So when we talk about high fat foods, we talk a lot of sodium that causes direct damage to our blood vessels. When they are directly damaged, that causes that inflammation. That inflammation causes poor circulation, which can lead to blood clots, issues with circulation. Again, so the whole inflammation process again leads to additional chronic illnesses. And that inflammation comes from stress,
Yeah.
stress, anxiety, just worrying, and not only internal stress, the external stress of, again, just being Black in America and in the world, and the constant pressures that we experience that others do not experience. When individuals come into a room, there's already a perception. I can talk about for myself. If I come into a room as the CEO, they already have formed an opinion about me. So I'm coming in there already, I won't say with a chip on my shoulder, but I have a level of anxiety that they do not have, and that causes internal inflammation and harms our bodies.
I can't even imagine. I mean, I don't even know how to explain to someone who is not Black
Oh, yeah, it's
what
just
that feels like.
no,
I
because
can't, and as a journalist, I can't find the words. I can, write certain things. I can say certain things, but unless you've experienced it,
right,
you really can't describe it. Just everyday, ordinary things.
everything.
Can I go to that restaurant? Am I gonna be okay in that bar? Can I stop in and have a drink at this little,
Mhm.
this little neighborhood bar or not? I remember one time stopping into a little neighborhood watering hole. As soon as I opened the door, it was like, what? You're in the wrong place, sis. So yeah,
Yeah,
just living,
just
just
living.
being who you are and trying to do everyday ordinary things, is hazardous to your health.
It is, and
One
and
thing that
it's
was go ahead, I'm sorry.
and it's privileged not to feel that.
Yes,
And when
absolutely.
people don't understand what privilege is, that's your privilege. That
That's
you
it.
you don't have to live that, and you don't have to ever experience that.
That's exactly right. I want to talk about um, COVID-19 and how that impacted our community. I want to understand where we are now from your perspective, what we should be doing. And I know that the vaccination rates, testing rates were low, vaccination rate uptake was low. We were just whole families being impacted. So, talk to us a little bit about COVID-19 in our community, where you think we are, and what's the next phase, because I don't think it is over, even though the administration has declared that in May we should be done.
It's
So,
funny,
talk to
funny.
us a little bit about that.
So, people always say that COVID, the whole pandemic kind of laid bare these disparities that were apparent in the African American community. COVID didn't do that. We already knew. We already knew these things were occurring, and we already knew from day one that Black people were going to be the ones that were disproportionately impacted. We knew that we were going to die at disproportionate rates. We knew it, and they knew it. So that's where we are, and that's still where we are today. That's
That's where we started, and that's where we are.
that there has been no change in the healthcare system, in my opinion, as a result of COVID for Black communities. None at all. And in fact, in many areas, it's worse because, as you mentioned, we were disproportionately impacted. So what I see is when you had those grandparents who were raising children who died as a result of COVID. We saw an increase in the number of foster kids. We saw an increase in the number of kids who don't have parents and who don't have resources and support as a result of COVID. We saw kids who weren't able to go to school, who have fallen behind so much academically because they just do virtual learning. Well, we that's not a reality for many Black children living in Black underserved communities. We don't have access to reliable internet services. We don't have necessarily parents in the household who are IT savvy and who can help our kids. And then we were working. We were at
Working
work.
two, three jobs,
We were
working.
working. They're like, oh, just stay at home. You work in healthcare or the service industry. You don't have a nanny. You don't have the privilege to stay at home. So that impacted us, the financial impact, the mortality impact on losing. And for us, those grandparents are our foundation. They're our rock.
Absolutely.
There are financial resources, their daycare. When that level was lost, that really hurt the Black community. So I say COVID set us back, 10 to 20 years health wise in the Black community.
Are there any strategies that anything that we learned from COVID that we can apply to help improve healthcare outcomes in communities of color?
So what I think that we should have learned is that we don't trust the medical system, and that it is necessary for us to have trusted messengers who look like us to speak and educate to the Black community. I think that what we should learn is that we need more Black medical providers. We need more Black nurses. We need more Black physicians because I go back to data, and the data doesn't lie. When you have Black providers treating Black patients, the outcomes are better, especially for Black men. When you have Black men who receive medical care from Black male physicians, their diabetes improves, their hypertension improves, the number of screenings, cancer screenings that they receive improve. So what we should learn is that we need trusted messengers who look like us to provide medical care to the Black community.
So that means that we're going to have a more orchestrated campaign to get young people to go into the medical field, whether it's being a pharmacist or being a doctor or a nurse or what have you. We need to do a better job at encouraging that.
We need to do a better job of encouraging and also preparing our education system so that they're able to compete and they're able to get those residencies so that they can provide that care to the Black community.
Oh, that's a whole other topic. I'm gonna write
It's
that
another
down because I'm
topic.
definitely having you back so we can talk
Right.
about that.
Because
Because that
we don't want to
the
talk about
preparation piece,
and the discrimination in medical schools.
absolutely.
It's
Oh my, yeah. So that's two topics. Great. So I wanna touch. We've just got a few more minutes, and I want to go back to the topic about childbirth
mm,
and Black women in that project. Can you talk to me a little bit more about that and
yes.
what are you currently doing? What can we do? And what should we be doing?
So what we are doing is really what I mentioned as well. We are actively recruiting and hiring Black providers. Black providers, pediatricians, medical providers, nurses, because there is a trust and there is an understanding that Black mothers, Black women have with talking to another Black woman or Black provider about their pregnancy, about childbirth. There's a cultural competency that occurs that often does not occur in non-Black providers. And that is not to say that non-Black providers don't provide quality healthcare. I'm not saying that. I'm saying that at the point we are, when Black women are 3 to 4 times more likely to die, if providing a Black provider is going to increase the likelihood that that mother survives, that's what I'm going to do. And I'm not really concerned about whoever is upset about that, because my priority is to assure that Black women live. So we, again, representation is everything. So we're focusing on increasing the numbers of Black providers. What we're also doing is we do group therapy. So we have group prenatal care where we have individuals who are delivering around the same time, and we have them come in a group setting, bring their partners, bring your spouse, bring whoever your support system is, and talk about what are your concerns. Are there socioeconomic issues that are impacting you? A lot of times it's diet. It's not having access to healthy foods. I always hear all the time, oh, they're just overweight because they eat all of these high fat foods.
Yes.
Well, I'm right here in on Biddle, and I can walk around here. I can't find access to healthy, affordable foods if I walk 5 miles either way. So it's providing those services. So we partner with the St. Louis Area Food Bank. We have a food pantry. We also partner with the St. Louis Metro Market, where we're able to provide those nutritious foods to our pregnant moms and to the children. We also have a WIC program that also supports nutrition. I want to go back to mental health, because one of the findings related to the mortality related to Black women is due to mental health issues. So providing that mental health support. You think it's hard being Black? Try being Black and pregnant.
And pregnant.
That is such a stressful time. So we are providing additional mental health support to our moms during pregnancy. And then another piece that people don't like to talk about is domestic violence.
Yes.
Um,
Yes. Critical role.
It's critical. It's absolutely critical. And you talk about the stress and the strain on a growing child when mom is dealing with domestic violence in the household. We have those discussions with our moms. We have group discussions. We have individual organizations come and speak directly to our moms about domestic violence. We're just really trying to, again, approach it from a holistic aspect. What are the factors that are leading to moms not being able to go full term with their babies? And then the other thing is advocacy, because I can talk about programming all day, but it comes down to policy.
Yes.
It comes down to policy and the fact that the Missouri legislature last year failed to extend postpartum Medicaid coverage for moms up to 1 year. So currently, after 6 months, after the mom delivers, 6 months, after 60 days, Medicaid terminates. Well, all of the data shows that the deaths for moms occur after that period, after that 60 days up to 1 year is when the deaths occur.
And those are numbers. That's not anecdotal. That's not somebody's opinion. Though that is hard fact.
It's hard fact. And for the Missouri, any legislature not to approve to extend postpartum coverage for mothers, knowing that they die from 60 days to 1 year, is absolutely horrible.
That is reckless.
I mean,
oh my goodness.
And so right now it's being evaluated. It's in the House. It's in the legislature now. So again, we're doing a lot of advocacy. I've done videos, recordings, commercials, just really encouraging our community to contact their local representatives and to get them to pass that, because that's how we save lives. It's programming helps, but policy is what is needed.
So we're going to have some information, and we're going to put that on the All In website and link, and we're going to encourage people to get themselves educated first. and then take action because it can save a life, or many lives in this case. So, is there anything else as we wrap up this session that you want us to focus on? You want us to be mindful of? I think the Medicaid issue is a big one in our state. Is there anything else, or is there anything you could share about that?
Yes. So there's another issue with Medicaid. So currently, there's a renewal process that's going to occur within the state of Missouri. So the renewals had actually stopped as a result of COVID and the declaration of the emergency, the COVID emergency. So now, individuals who are Medicaid enrollees will have to provide information to renew for their Medicaid. So this will start April 1. And the way the state is contacting these individuals is by mail. Well, the individuals that we serve, the community that we serve, are very transient. So their addresses change. So we're very concerned that they are not going to get that renewal notice and not renew. So again, we're reaching out to the community. Our outreach department is out in the streets. We're promoting this on our social media, trying to get everyone to update their address information with their local Medicaid office so that they can get that renewal. Because what happens if you don't respond to the renewal, you are disenrolled.
They will drop you.
They will drop you. You're sick, something happens, and you have no insurance.
So we're going to help you with that. We'll get the information, anything that you have, any printed materials, anything that we can do here at the Urban League. We have a phenomenal team in our public safety department that goes out into the community and provides them with access to information about vaccines, about COVID-19, about influenza. We have a team that checks on people regularly within a particular area. So we'll be happy to help get that information out because it is, again, a matter of life and death. So Dr. Kendra Holmes, I cannot thank you enough for spending time with us today on the All In podcast. And we will certainly have to have you back because there are just so many things that we can talk about. And we hope you'll consider this your home. And if there's information that you need to get out and you want to communicate to the public about anything relative to health equity issues in our community, you are welcome here.
Thank you so much. And I just want to end by saying thank you to the Urban League. The Urban League is doing amazing work in our community, and just continue to work with them. We're absolutely honored to partner with the Urban League.